What is lapse, relapse and relapse prevention? Substance relapse means returning to their previous level of substance use after a period of abstinence. Relapse is usually preceded by a period of lapse. A lapse is a little slip-up or a momentary use of substance after a prolonged period of abstinence. People usually believe relapse is just an out-of-the-blue event. They believe prior to their relapse, as if everything were right and the relapse came out of nowhere. But relapse is always a process. The process may start with some sort of life stressors. The relapse is a process, and it builds up over a period. Recognition of pattern and timely intervention can prevent an episode of relapse. A relapse impacts people's self-esteem, and they feel unworthy to try to give up substance again. The snakes and ladder game. Relapse of addiction can be explained by popular snakes and ladders game. Long snake. They represent the prolonged episodes of relapse. They take longer time to become sober again. They are probably living in a high-risk environment. Short snake. They represent very short-lived lapse episodes. These episodes are called a lapse instead of relapse because they return to the sober state quickly. They are probably living in a low-risk environment. Long ladder. They represent people with high level of internal motivation or having strong desire to give up a substance. These people have a high level of external support. They have easily accessible addiction treatment facility in their vicinity. Short ladder. They represent people with a low level of motivation. They have only external motivation due to outside pressure. They have poor external support. They are the people living in the remote areas with a limited accessibility to addiction treatment services. What need to be done to prevent relapse? The main treatment goals of the substance use disorder are to minimize number of snakes and increase number of ladders. Long snakes should be strategically avoided to prevent a full-blown relapse. That means we need to do some environmental modification and eliminate of risk factors to prevent a relapse. Long ladders should be strategically strengthened to maintain sobriety. In other words, community and family should be encouraged to embrace and support addictive disorder patients to recover.